Arkansas is next. I'll turn it over to you guys.
Can you guys see us and hear us?
Videos.
We can hear you, but we can't see you. Oh,
Can you
now
see
we
us
can.
now?
Yep, you're good. We can see
All right.
you.
Okay, cool. Hey guys. Hey, so I'll introduce myself. My name's Lee Austin. I'm the program coordinator.
Hey, Ronnie Lindberg. I'm the program director.
I'm Lucas Spider. I'm one of the two.
Colby Smith, and I'm PG-1.
So thanks everyone for taking the time to join us and learn a little bit more about UAMS. I've got our PowerPoint here. Just let me share screen and I'll pull it up and we'll get started. All right, everyone see? Well, there it goes away. I know, technical. Can everyone see all right?
Yep, you're good.
Okay, cool. So thanks for joining us today to learn more about UAMS, University of Arkansas for Medical Sciences. Just a little bit of information about us. We have our administrative staff here. We got Dr. Kevin Means, who is our department chair, and our associate program director, Dr. Lindberg, who was our program director, and myself, who I'm the program coordinator. If you can't tell by now, we're slightly on the silly side, but we do take what we do very seriously. But we like to have fun doing it. And also here's our chief. So Lucas is right here behind us. Jose Davila, who's another PGY4, would have been here, but he is on vacation. Bless his heart. So just a little bit about PM&R at UAMS. Our mission statement is to sorry, feedback. Okay. Sure. So our mission statement is to improve the health, quality of life, and function of individuals with acute and chronic musculoskeletal conditions, brain and spinal cord insults, and neuromuscular disorders through compassionate, patient-centered, and team-oriented delivery of the highest quality patient care, state-of-the-art and evidence-based education of students, physicians, clinical investigators, and allied health systems providers, public service to Arkansas and to the national and global community, and research which generates new knowledge that can be applied to the health and functional challenges that face our world. So our program aims, and program aims, or ACGME asks all the programs to create them. They're more or less like little statements that you live by in your program and what your main function and goals are. And our goal is to train well-rounded physiatrists in a variety of clinical settings who will be successful in a physiatric practice, well qualified to pursue fellowship, or prepared for an academic practice setting. Also to ensure that our resident physiatrists have accomplished all educational goals, medical knowledge milestones, procedures, passing your boards, setting up for success.
Hey, I'm sorry to interrupt you guys, but you guys have a lot of feedback during the presentation, so.
Oh, okay. Hold on one moment. Is it still bad?
It's still there, but it's not as bad.
Okay, I'm sorry.
No, that's okay. I just wanted to give you guys a heads up.
Okay. Okay. So, oh, I didn't even talk about the faculty. I'm sorry. I got all caught up in the feedback business. So, this is kind of a little amalgam of our lovely PM&R faculty here. We have, you got Dr. Kaiser. He's our spinal cord man. There's, of course, there's Dr. Lindberg. You've got Dr. Howard here. He's one of our newer faculty members. He is our MSK guy. And Dr. Means, he is our backlift and pumping. Y'all please feel free to hop in. Y'all know that I'm,
He's a general physiatrist and does a lot of our backlift and geriatric rehab. The princess in the corner is Dr. Hobart. She is one of our pediatric physiatrists, and just opened a big spina bifida clinic in the state of Arkansas. It's huge and one of the only ones in the state, and very interdisciplinary. It's undertaking, so that was a good deal, and we're super proud of her. And then the group picture, again, has Dr. Kaiser, who has a funny smile, and he's known for spinal cord, Dr. Means, myself, and Dr. Tompkins in the middle, who's another spinal cord, another pediatric physiatrist, does a lot of cerebral palsy, spasticity management, also found out of injections. Dr. Ade Oba in the red dress, one of our interventional physiatrists and pain physiatrists, and then Dr. Steffens in the back of that check. Essentially runs the muscular dystrophy management and neuromuscular pediatric disorders in the state of Arkansas. Our pediatric physiatrists are also the only ones in the state who do pediatric EMGs. And so we are the only source for that in the state and most of the surrounding regions as well. And then two of our newer faculty, Dr. Moni on the left bottom. She is just about to take her brain injury board. She's super excited about that, but she does traumatic brain injury in addition to general brain injury. And then our newest hire, who's joining us in a couple of weeks, Dr. Tori Huntrin will be a general physiatrist with emphasis on stroke rehabilitation. And then we don't have an updated picture of her, but we also have Dr. Megan Wilson, who joined us after completing her spinal cord injury fellowship at Shirley Ryan. And what's really cool about Dr. Wilson is that she is a C5 quadriplegic. And so she is doing amazing things for spinal cord management in the state of Arkansas, just with her experience personally and through her training. And she's freaking amazing. And so she's also one of our new faculty too, but we just don't have an updated photo of her just yet. And then all our fun residents.
Got our little group photos. We've got our PGY1s. We see somebody right there that we recognize who's in the room with us right there. We've got PGY1s, 2s, 3s, 4s, and our lovely Jose there in the middle.
But definitely check our website out. It shows the residents' interests, where they came from, what their career interests are, in addition to just personal interests. And a lot of that ties into a lot of the activities and availability of our program and in the state and the region too. And so it's a good way to get a feel for what we have to offer in the state of Arkansas is by checking out our resident interests, which we've had fun posting on the website for everybody.
So we have 4 main practice sites. So we have UAMS, where we do all of our outpatients. So
You may want to turn it just a little bit to you because we can't hear you. When it goes back and forth, we can hear whoever it's pointing to.
Ah, gotcha.
Yep,
Okay.
now you're good.
So we have 4 practice sites. So UAMS, you have the clinic in our spine institute building, where we actually have all of our faculty offices and everything as well. Then the clinic where Dr. Lindbergh and Dr. Moni see their patients over at the Colonel Glenn Clinic, and they also work with our residents work with some of the ortho docs over there as well and see patients. And then anesthesia and interventional pain clinic at UAMS on campus. That's also where we send our residents. Mostly 3rd years, 4th years, some. Consults are seen at the main hospital, and that's basically everybody from 2nd on through 4th year. But in your 4th year, you get a consult rotation. Our rotations are 3-month blocks, so you have that to look forward to in your 4th year. Also in your 4th year, once a month we send a resident to the burn unit over at Children's Hospital, and it is the largest burn unit in the state for adults and peds, and it is a really cool opportunity they work with Dr. Tio over there, and so that's once a month for our 4th years. And also for our 3rd and 4th years, we have several of our private practice folks that we work with in interventional and regenerative, and we send them over there and go hang out and have fun. I say have fun. I know it is fun. It's work though at the same time. Our main big lots of love place where we do a lot of our rehab is Baptist Health Rehabilitation Institute. It's the most experienced PM&R hospital in the state, largest, most comprehensive rehabilitation facility, and also it's the facility certified in brain injury, spinal cord injury, amputee from CARF, from the Commission on Accreditation of Rehabilitation Facilities. So that has, you know, y'all can talk a little bit more about what Baptist has to offer.
Yeah, it really is, and this goes for all our, including our outpatient facilities too. But it is the top rehabilitation unit in the region by U.S. News, just almost annually, because it is the largest one and it has the most technologically advanced equipment of the rehab institutes in the state and in the surrounding regions, which includes southern Missouri, western Tennessee, northern Louisiana, a tiny bit of the northeast corner of Texas, eastern Oklahoma. So we service those entire those areas in addition to the state of Arkansas. And because we're the only academic institute in the state, both in our inpatient rehab and outpatient, we get all the cool stuff. So we don't have competition from other large rehab institutes or even the model centers. And so all the cool traumas, all the interesting genetic disorders, neurologic disorders, all the zebras come our way. And so our residents tend to get exposure to something during their 4th year, during their 4 years with us, whether it be through our inpatient units or our outpatient, which is really cool that you get to have hands-on exposures to some of even the rare rehab diagnoses, because we just don't have competition for that. So we do stay busy, but it is a fantastic learning hospital. In addition to residents and students, we also have student therapists who are working with us and our resident and student teams to help teach each other and educate each other also.
Right. So children's, if I remember correctly, it is the 7th largest children's hospital in the country, and has we have inpatient and outpatient rotation there for our residents. So they have a 12-patient in-bed unit, and then the outpatient has the habilitation clinics, spasticity management, multidisciplinary, and then there's also community outreach clinics. So our docs will go out to different cities. A lot of times in Northwest Arkansas, there's another children's hospital in Northwest Arkansas, and they'll take our residents with them to experience that. But there's other community clinics out in smaller areas of the state, like I believe there's Texarkana, El Dorado, just in more southern areas, so they can go and visit their visit patients there as well. And again, all this information is on our website as well if you wanted to look more into the different facilities that we have. And then the VA. So what we haven't mentioned yet is that all of our facilities where all of our residents go to, and even the private practice, are within like a 10 to 15 minute drive. So everything is centrally located. So if you are at the VA, you can still park at your UAMS parking spot to go to the VA. So I mean, it's all really easy to get to. It's very centrally located. But back to the VA. So when you're on your PGY 1 year, you do have your cardiology one month there, 1 month of geriatrics, and that's at the North Little Rock VA, and then 3 months of med wards. Outpatient, somewhere between your 2nd and 4th year, you're going to do your EMG rotation there. And that's like all the EMGs you could ever hope for and more. So you will definitely get your procedures logged for that. And then there's also a outpatient VA UAMS split, which is 2 days at the VA doing their outpatient clinics, and then 3 days at UAMS doing our outpatient clinics. Best thing about the VA is that you don't have call while at VA. Everyone can agree on that. So I know what everyone's interested in, what the first year looks like. So this is just a rundown of what our, we're categorical. And so we, have our first years with us, but they're, going around to different, the different areas of different offsite rotations. So you have your 1 month of cardiology, and that's at the VA, 1 month of emergency medicine at Baptist. And then you have your 3 months of med wards, 1 month of geriatric, you have a month of neurology, orthopedics, you have a month of orthopedics with UAMS, and then everyone loves the PM&R rotation. You'll work your butt off with that because you're working with Dr. Kaiser on that month. And then month of ped wards, doing general ped wards, month of rheumatology, month of radiology. And then the continuity clinics, what we discovered after talking to our first years, what they really liked was being involved in our didactics. And so we worked it out with the VA and with Baptist and with the UAMS rotations that when our first years are on those rotations, they actually participate in didactics with the 2nd through 4th years. And that really helps with the sense of community. But the children's, if you are at children's on that rotation, you do end up doing 1 day a week at their outpatient clinics, the neuroscience center. And
You guys have just about 5 minutes.
Okay. So our PGY 2 through 4, like I said, 3-month blocks, minimum 12-month inpatient, minimum 12-month outpatient. And then you have your inpatient rotation for children's, outpatient rotation for children's. When you're at BRI, you get on stroke service, TBI, SCI service. And then again, we've already mentioned the EMG rotation at the VA, and then the VA split with the UAMS. So didactics, this is what our didactic schedule looks like. Again, this is on the website if you wanted to look at it some more. One thing that what we really have really good work with on our didactic schedule is that we rotate every year, and it's a 2-year schedule. This is a list of the kind of things that we cover in each year. It's really heavy session anatomy, got a lot of good stuff there. We have ultrasound sessions, peds, rehab research, SCI, cancer. I mean, we have but this is on a 2-year rotational block. Again, this is available on our website if you wanted to look at it to get more information. Mentor groups, that is something that we developed a couple years ago that really act as the backbone for all of the basic structure for all of the residents' scholarly activity and QI projects. There's more information about that on our website too, but mentor groups are basically the building blocks for journal club, M&Ms, case reviews, all the anatomy things. And you get 2 hours a month in protected didactic time for scholarly activity through the mentor groups. And that's something that our residents do really seem to appreciate. We take well-being seriously. We have social activities, didactic wellness lectures, stress management, wellness check-ins, but it's something we really do focus on. We're our own little family, our own little team, and we check in with each other, and we care for each other a lot, and we have fun. We try to have a lot of fun. But these are just some of the things that we have done in the past, different activities, obviously pre-COVID. But one of the things we did want to point out that the natural state, I don't know how much y'all know about Arkansas, but if you are an outdoors person, if you enjoy nature, if you enjoy being outside, it's definitely a wonderful, wonderful place to be. So just finish off with some pictures and take some questions.
You guys have just over about 2 minutes. Guys, make sure you can ask questions either by unmuting yourself or in the chat. So you guys got questions about opportunities for community outreach?
There are definitely opportunities for community outreach. The university itself has a lot of different programming and different groups, depending on your interest, diversity included, free clinics, culinary opportunities. There's a culinary medicine group. So tons of stuff just within the university in the institute setting itself that resident physicians are allowed to and encouraged to participate in. But the program itself we do ask as an extra educational opportunity that the residents participate in some sort of community outreach. whether that be through one of the outreach clinics that our pediatricians do, whether that be through spending a day at one of our post-acute rehab facilities like Neurorestorative Timber Ridge, or going to Easter Seals, or even every once in a while going to clinic at one of the local prisons with one of the faculty member who does something like that. And I believe the opportunities will increase now that we'll have virtual abilities to reach some of these more underserved areas of the state. We do have a very large telemedicine clinic opportunity through our department. We were one of the first programs in the state to develop this, and one of the initial PM&R programs to develop a telemedicine outreach clinic for traumatic brain injury and spinal cord injury patients also. So tons of opportunities for community outreach. And so what are we looking for in an applicant? We definitely want somebody who fits in personality-wise with us. You know, folks offered an interview with us meet all the criteria on paper, and most people do, because PM&R applicants tend to be just smart and you know, dedicated, ambitious. We're looking for folks who will fit in with our small, well, I guess medium-sized family. And so interview day is really important to us. I know it's all virtual, and we don't like that. We love for people to see us and meet us and talk to us, but we are going to try and make sure that everybody gets the opportunity to meet as many people in our department as possible, because we do work and function as a family, and we want to make sure that everybody's personalities mesh. We need, you know, independent learners, enthusiastic learners, supportive teammates, and so that's what we're looking for, folks who've shown signs of independent learning, and who are innovative thinkers, who are going to, you know, think outside of the box and help develop our fairly young program. We've been around since about, I think, 1984, one of the youngest programs in the state of Arkansas. And so we are still learning and developing, and we are a program where you can leave your footprint, which is super exciting. And I guess Colby and Lucas can add on if they have any residents.
Guys, I actually gotta cut you off, but I'm sorry. I even gave you an extra minute and a half. But thank you guys so much. To all the programs.